Hey guys, I hope that you're doing well. I'm coming to you today to talk about the 6 arm surgeries that I had done earlier this year. And I want to do a video instead of just typing everything out because I really want to give you guys an idea of what took place, why we did the surgeries, what exactly the surgeries are, and show you them and show you just some information from my doctor. So I guess here we go. So I met my amazing arm surgeon last year. His name is Dr. William Erickson. He's at the Hand and Nerve Center in Erickson Hand and Nerve Center in Seattle area. He's just a little bit outside of Seattle, and he does these cutting edge, really awesome arm surgeries for people with EDS. He's a brilliant mind, far beyond that of most doctors I've met. He was MIT and Harvard trained. He's one of those like geniuses that I could just imagine being like watching on something. I'm trying to get him to do a TED Talk because he would be brilliant at it. He's a phenomenal physician, a phenomenal person all around. He was trained in collagen and elastin disorders, so he's very familiar with EDS. He's come up with a couple different surgeries that really seem to help people with EDS. So he's like a cheerleader for us, and he fixes us. He does things that actually fix us for the long term. Like long-term fixes for these problems that we have, instead of just doing something that might last a little while or something that's not going to work at all because of the weakness in our collagen. So what I really want to go over first before I talk about the actual surgeries is he's come up with this sort of diagram, this grid of what it looks like when you have a bunch of different stressors and how that affects your body when you have, I'm just going to go with EDS because that's what I have, and how it affects your going down from these stressors all the way down your head into your arm. It's really kind of a crazy concept that he came up with, and it's so true to form. Everybody that he's met with EDS has these exact same issues, so it's not like this idea that came to him that doesn't have any backup. Every single person that he meets with EDS has these comorbidities, and in addition to that, I got into the conference this year. I worked hard to try and get him to be a doctor there, and so he spoke at the conference in 2014 in Houston for Ehlers-Danlos syndrome at EDNF's conference, and he did a talk on all of this. So if you guys saw the talk, you'll see what I mean. But so anyway, I'm gonna hold up this chart. It's really hard to see what is exactly going on, so I'm just gonna kind of go through it and explain it, and then I'll post the link to it on the blog. Okay, so basically, I'll just go through the list of everything that he kind of lays out. So emotional stress creates emotional fatigue, which makes sense. You know, you're mentally struggling, it's going to create mental fatigue. Physical stress, so the physical stuff that we deal with from EDS is going to create physical fatigue. Financial stress leads to loss of independence. We're not able to work as much, and so therefore then we're not able to work as much, and so we feel like we've lost out on all of these different things. EDS, it feels like it like takes stuff away from us. And then your failed expectations lead to depression. So this cycle just keeps going on and on and on. It's invisible, all of this suffering, even though they're far from, the reality of them is far from invisible. Just looking at us, you can't tell that all of this stuff is going on. But what that does is all of those four things, so the emotional stress, the physical stress, the financial stress, and the failed expectations, create all of the fatigues, your loss of independence, your depression, creates poor posture. You end up just being slumped over from physical pain, from emotional pain, from the depression, from just the struggle of it all. The slumping over of everything creates your cervical spine, it ends up moving forward. The weight of your breast, if you're a woman, pulls down. That creates thoracic outlet symptoms. So issues with your shoulder, and creates shoulder instability. The gravity that pulls down on all of this doesn't help any of these matters. It creates radial tunnel syndrome, lateral epicondylitis, synovitis, radiocapitellar joint issues, proximal median nerve entrapment. It keeps running down. Wrist instability, issues with your joints in your thumb, carpal tunnel syndrome, flexor tenosinovitis, and stenosing tenosinovitis. Those are hand issues. So pardon my terrible pronunciation of those words. So all of these things are then made even worse by the normal aging process and by obesity. So you get all of this invisible suffering going on, creates this whole set of symptoms going all the way down your head into your arm, all the way radiating down your arm and into your hand. So he calls these comorbidities a critical sum. I'll post the info from this page on the blog. It's really, really true to my case anyway. So what does he do for all of this? Well, he does this set of surgeries pretty much on everybody, because they all have these same symptoms, on everybody that has these collagen disorders, so like EDS. He goes through and he does these really unique and creative surgeries to fix all of these issues. He deals with the upper or the lower arm, like your this part of your arm and your hand. So he does surgeries on those parts of your arm to help correct what has happened from all of this stuff that's gone on all around us. I was going to just list out what types of surgeries I had done on me, but they're quite extensive, the list, and most of you aren't going to understand what any of that is. So what I wanted to do was go through each surgery and just kind of tell you what the surgery is, why I had it done, and what the outcome is. So I'll go through and I'll show you. I have scars. I have a scar on my thumb right here. I have two little scars right here. I have a scar right here. I have a little teeny scar right here. I have a scar right here, and one on my elbow. But they're all very, very small. The only significant scar that I have is the one that's about an inch long on my thumb, and it's the only one that's like raised up and looks like anything. The rest of them are going away. They're barely even noticeable. They're all very, very small incisions. The largest was about an inch. So that's really nice too, because most surgeons that go in to do any of these types of surgeries, they do really big incisions. I know with the nerve entrapment issues, you know, people have at least several inches of scarring. With the way that he does these, the scarring is very, very minimal if that's of an issue to you. To me, I really don't care. I'm going to be having an auto transplant where they cut me 12 inches down the center of my chest, or belly. So scarring to me is beside the point. But some of you might care. Plus, it means that healing time is a lot quicker because you have much smaller incisions. So the first surgery that I had done was called lateral humeral epicondylectomy. What that means is basically lateral epicondylitis is what it treats. Lateral epicondylitis is tennis elbow. If you've been diagnosed with tennis elbow, it causes pain in your elbow that radiates down your forearm and your hand. It can cause weakness. Mine was so bad that I couldn't write at all. I couldn't type. I couldn't do anything. Because of all this, I was in a hard brace for over a year. From another doctor who that was his fix for everything. He said he gave me a couple of cortisone injections for this whole arm and said, here's a brace, wear it, you're done, and out the door. And Dr. Erickson says, no way, we can go in and fix all of these problems that you have in your arm by doing a couple of surgeries, and we do them all at the same time. So we did everything all at once. So I tried ice, I tried meds, I tried rest, I tried the cortisone shots, I tried PT, I tried the braces. What did he go in and do? He expanded the groove in my elbow where the nerve is to make more room for the nerve so that it has less of a chance to get irritated. So he just went into my elbow and basically made that area bigger so that I would have more room for the nerve that runs through there so that it doesn't cause me as much pain. So that's what a lateral humeral epicondylectomy is. Something else that he did, if you have EDS, you've probably fallen in your life. You probably don't even know that this is causing you pain, or you do, but it's so low on the radar of things that bother you that it's not a big deal. But the outside of your wrist, there's that little nub right there. That is called your pisiform. It's the bone on the outside. And if you've ever taken a fall, you go to catch yourself with your hands, you probably have hit that. And with EDS, we fall a lot, or we bump into stuff, and our hands constantly are getting hit. Well, what he did is he did a carpectomy of the pisiform. Basically, all that means is he went into my hand right here, under the bone, and he removed the bone. He just cut the bone out and got rid of it. What that did is it took away all that pain right there. I didn't even realize I had the pain there until the pain was no longer there, and I went, oh, wow, you're right. I did have pain there because I'm not feeling like I normally felt. It was very, very strange. When he went in, he sure enough looked at mine and it was broken. So I had this broken bone in my hand that I didn't even know was broken, and I didn't even know that it was a problem. But so he did a carpectomy of the pisiform. He did a capsulodesis of the wrist. Basically, what that is he did an incision in the wrist. So I have an incision here. I also have an incision here in the front. he went into the wrist, he opened up the wrist capsule, and then he secured everything in my wrist to make my wrist stable. He secured that joint. So my wrist is so much more stable than my left wrist. My left wrist, I can't even pick up a bag of groceries or anything like that. My right wrist, I can now pick up like a bag of groceries. It's crazy how much more stable. He's pulled and tried. We can't dislocate the joint anymore. I mean, it's amazing what he was able to do in my wrist to make it more stable. So my strength is greater. My wrist hasn't dislocated. So that was all when he did the capsulodesis of the wrist. He did a right thumb CMC joint arthroplasty with FCR tendon transfer. This was originally this surgery was designed, made up, whatever, by this doctor, these doctors Eaton Littler. Basically what it does is you reconstruct the ligaments in the wrist for the painful thumb carpal metacarpal joint, so the CMC joint, carpal metacarpal joint. To put this in the easiest way I can, so the big joint in your thumb, not the little one up here, that in most people with EDS is pretty, here I'll do this one, it's, you know, it's pretty, like, it comes out really easily, it moves around really easily, it causes pain, weakness in it, all of this. So he reconstructs the ligaments so that it holds your thumb in place. It's basically like a permanent ring splint that he does with your tendons. So he takes your tendon and first he removes a little piece of bone in your thumb, and he takes your tendon and he wraps it around in a figure 8 around your thumb, and then he squishes the extra stuff back into that little hole, and then he just puts everything in place and closes you up. So it literally is like it's like a ring splint around your finger. It's this like figure 8ing of this tendon to make your joint stronger and more stable. It's crazy. I mean, it's like I have a permanent ring splint. I'm getting rid of my ring splint. That's how permanent this is. There's no need for it. I've been over 6 months now. Let's see, we're 7 months, and it's amazing. It's absolutely amazing. I still have a little bit of pain. It's the only, so the rest of this is completely all healed up. I still have a little bit of pain in my thumb joint, in my carpal metacarpal joint. I think it's just going to take some time. It was a major surgery on it, and it's just going to take time for it to continue to heal and get better. It seems to get better a little bit each month. You know, I'm going to give it some more time. And he says that the healing is just fine. Everything's going smooth. So, another thing that he did, and he did that with this little incision down here. So if you look at this hand, if you look at my left hand, and you go to pull my thumb joint back, you can just pull it back all the way. I have zero strength in my thumb joint right here. I can't even pull it up. I have zero strength in that joint. I also have zero strength in my little joint right here, in this little joint. I can just, using all my might, I can't do anything with this. This joint has zero strength. In this hand, he went in somehow in here and with tendons was able to pull stuff so that I now have all of this strength in this thumb joint and this index finger joint. I can open up a bottle of, like, I can open up the tab on a can of soda. I couldn't do that before without a ring splint. I can grip things, I can pinch things, and hold them tightly. I couldn't do any of that before. It's just insane. So he gave me all of this strength in these two joints by doing this, whatever he did here with this incision. So the big one that he did, and this is gonna take a little bit more time to explain. I had proximal medial nerve entrapment, and proximal median nerve entrapment, and he did this surgery, this release, in this very, very, very special way that fixed the nerves that were causing me issues. It's a very rare diagnosis because most people aren't even familiar with it. He's written this great article, and I'm going to post this on the blog as well. But I'm just going to read a little bit of it to you and then explain basically in layman's terms what the surgery did. So to fix the proximal median nerve entrapment, he did a tenotomy pronator teres and common extensor fascia surgery and neurolysis of the proximal medium and radial nerves. So he did those two surgeries. That probably sounds like a foreign language, so I'll explain what those are. But so basically, proximal median nerve entrapment, PMNE, is a challenging diagnosis for many reasons. Inherently vague complaints, subtle physical exam findings that are not well described, electrodiagnostic tests are unreliable to confirm the diagnosis, and the results of surgery can be unpredictable. The anatomy around PMNE and around the proximal median nerve adds to the complexity of the diagnosis and the treatment, and there are multiple anatomic features in the region of the elbow with the potential to cause compression of the nerve. It's been recommended that surgical decompression of the proximal median nerve, if considered, address each possible area of the compression. Large incisions about the elbow permit full visualization of pertinent anatomy, but can cause seriously disfiguring scars. So this paper describes the use of two small incisions which allow safe visualization of the entire proximal median nerve with cosmetically acceptable scars. So basically, what this is they used to do this surgery, these two surgeries, the tenotomy pronator teres and common extensor fascia, and the neurolysis of the proximal median and radial nerves. In order to do those surgeries, they would make this incision that went all the way down the arm, and they would open you up so that they had a full view of the proximal median nerve, and they could do this decompression. Half the time I'm hearing from people that their decompressions didn't work. They have this huge unsightly scar. So Dr. Erickson was like, there's got to be a better way. So he started doing these crazy things to figure out how he was going to make this surgery be minimally invasive. And it got so crazy, and I wish that he were here so that he could tell you the story. But he decided that instead of making this giant long incision down your arm, it was going to be a short little W. And he thought he could do that. So he wrote out this little diagram on a Post-it note with the W incision, and he had a surgeon friend of his go in and do surgery on him, on Dr. Erickson. So he had surgery done on himself to prove that it could be done with that shorter incision. The guy is a genius. So from there, his brain just kept on working, and he got it down to two little incisions. So I have a little centimeter incision here and a little centimeter incision here. One above the elbow, one below the elbow. And that's it. Instead of doing this huge open thing. So PMNE presents with complaints of hand pain, wrist pain, and hand weakness. You know, I was having all of these issues, and I had no idea that they were caused by nerve entrapment up here. But they were. And he went in and did these surgeries, and it's fixed it. It's completely better. So he says that the pain is in the distribution of the distal median nerve, like your hand and your wrist, and the pain is provoked by activities of repetitive nature, like typing, writing, driving, use of a cell phone. And the hand weakness is isolated from the FPL and the FDF-IF, which are innervated by the AIN. So we're getting here technical and he's just talking about different nerves and the areas around them. So, I think that's all I'm going to talk about from here. So basically, what he did to fix this, he did what's called a tenotomy, which divides the tendons, and a neurolysis, which surgically frees the nerve from the inflamed tissue around it. And the fascia, so he cuts through the fascia, he cuts through the first layer of fascia, he cuts through the second layer of fascia, he gets to the nerve area, he divides the tendons, and surgically frees the nerve from the inflamed tissue. So that's where the tenotomy and the neurolysis come in. And like I said, the way that he does this is highly, highly unique, innovative, and highly successful. He's not had anybody that this hasn't worked in, from what I remember him telling me. So yeah, so that I hope explains what went on a little bit better. So I'm just going to draw on myself really quickly to show you how big these incisions are so that you can see, because it's really hard to see. The scarring is so much better that you can't even see. And I'm drawing with my left hand, so it's going to be kind of a mess. But so I have 2 little incisions there. I have 1 incision there. I have 1 incision on the side of my thumb, if you can see that, and that's where he did that really cool thing that makes the ring splint basically around my thumb. I have this little teeny incision right there, and that's what he did to fix the strength in these 2 fingers. And then the proximal median nerve entrapment surgery left me with the 2 oblique incisions. And last but not least, the surgery to fix the tennis elbow left me with 1 incision there. And so that's it. I've got a bunch of little teeny tiny incisions, and we did that many surgeries. Did them all at the same time. I went home that day. I was in a cast, a very small hand cast that just literally went over here to here to here. It didn't even touch my wrist. It was just the base of my hand, and all it was to stabilize my thumb, so that my thumb would be in a place that was like this, so that I could touch my fingers together as it healed, so that when it was healed I could still grip like this, because otherwise it would heal back here and I wouldn't have the grip. I wouldn't be able to touch my fingers together. So it just holds your thumb out in this kind of a weird, awkward position. And I wore that splint, gosh, 2 months, maybe not even 2 months. And then we took the splint off, and that's it. I didn't do any physical therapy. He didn't want me to do any PT. That's it. It was all over and done with, and I am so happy that I met him and that I was able to have these surgeries. I was so fortunate. I'm going to go back and have my left side done, but I'm not going to do that until after the auto transplant and everything is taken care of. But this has just been, it's been phenomenal, and I recommend anybody coming out to Seattle to see him. He really wants to expand his client base. So Dr. Erickson, shout out to you. I love you so much. And I will be posting everything on the blog. So if you are watching this on YouTube, please check the blog so that you can see the diagrams that he has. And also I will post a couple pictures from my surgery. Anyway, I will post the information about the blog post below. That is all, I believe. So anyway, again, just to wrap up, the surgeries I had done. Capsulodesis of the wrist, right thumb, carpometacarpal joint, arthroplasty with FCR tendon transfer, lateral humeral epicondylectomy, carpectomy of the pisiform, tenotomy pronator teres and common extensor fascia, and neurolysis of the proximal, medial, and radial nerves. And there you have it. All right. I'll post all the info for Dr. Erickson as well so that you guys can get in contact with him and get your arms fixed too. Okay. Have a great day, everybody. Bye.